Well, good afternoon. I'm Ken Bibroy, and welcome to Coffee with Ken, a thought leadership series at the nexus of business, politics, and air quality today. We have been doing Coffee with Ken for so long now, over 5 years, that we are hitting the point where we bring our guests back so that we can catch up, we can talk about what's been happening. And one of the most active guests that we've had is Rachel Hodgdon. And Rachel runs IWBI, and we are laser focused on a pretty exciting announcement that you're going to be making during Climate Week this week in New York City. What's happening?
Well, first of all, thank you so much for having me back. I love a repeat performance. Look, Ken, the energy this week is incredible at the United Nations. Climate Week has already brought an amazing focus on sustainability, but now healthy indoor air quality is front and center. And it's so gratifying to see IAQ being widely recognized as a critical public health priority. As someone who has seen the effects firsthand of people who suffer from long-term health issues because of compromised indoor air, my mom included, it's always surprised me that historically people don't really make that connection between their quality of life, their health, and the air that they're breathing 90% or more of the time. But that is changing now. And leaders from nearly 30 countries are gathering today, ready to collaborate and take action. You can feel the excitement in every conversation on the ground. It is inspiring to see the Global Commission on Healthy Indoor Air officially kick off at this momentous week.
I mean, so just the magnitude of that, right? Like, we first spoke during COVID when it was like a lot of attention on air quality and health and wellness, right? And then the world's kind of been moving along and we've kind of emerged and so on. That's why I think this is so exciting, because not only are you kind of like bringing this conversation back to the forefront, but it's a truly global coalition. So talk a little bit about how you got to this point. Like, how was it building that coalition, getting folks to maybe refocus again on such an important topic as indoor air quality?
Well, first of all, I think you make a really important point that in many ways, the momentum that has gotten us to this place began during the pandemic, when I think on some level, everyone made even just like a light connection between the quality of the air that they were breathing and their health and safety, whether it was because you were afraid to get in an elevator or you were really proud of the office that you worked in and knew that they were taking care of your health by doing all of the right things for filtration, ventilation. People really started to make that connection, like the average person started to make that connection. So, bizarrely, we have this global pandemic in some ways to thank for temporarily elevating that awareness. But also, like you said, people then just wanted to get back to business as usual. And so in part, this idea for the Global Commission on Healthy Indoor Air was born of a desire to keep this at the top of people's priority lists. So what has it been like to bring together well over 100 now commissioners from about 30 countries? I'll tell you, a labor of love, because the people who have joined as commissioners are icons in their areas of research, academia, advocacy, and policy, business. We really wanted like the top minds, the top voices, a really diverse collective of people that could help to steer the ship and identify all of those different levers for market transformation that we know we have to activate to get to a place where every one of us can enjoy healthy indoor air as a fundamental right.
When we started this series, it was really grounded in kind of conversations at the nexus of kind of a Venn diagram around the public sector, private, and kind of education, nonprofit advocacy, right? And it kind of like this moment in this commission kind of is basically exactly that, right? It's like surgeon generals, government leaders, private sector leaders, you as the kind of nonprofit advocate, right? How important is it to have that kind of secret sauce amongst 100 commissioners, the breadth and diversity of their backgrounds?
Yeah, like to your point, that is the secret sauce, the diversity. Because I think what we saw was that there are a lot of amazing individuals and organizations that were putting healthy indoor air at the forefront of their efforts or their research or their business. But so much of that effort was happening in silos. And so, there are people who are, bringing forward landmark research and like, okay, now let's just transform this into policy. And it's like, wait, there are so many other things that we have to do to be able to have success in translating research into practice or into policy. And so in many respects, this global commission, it's not about new strands of efforts, it's about weaving those efforts together into some type of, cohesive fabric and framework for action so that we can drive forward with coordinated solutions and building sustained awareness through a multi-year effort.
And what did you learn globally in partnering with, leaders from hundreds of countries, making this a global effort? Do we have relatively high expectations and standards in the United States? Are we middle of the road? Or are we bottom of the pack? I always kind of wondered that, like, how do we stack up against others? Is there the same level of interest and focus and kind of,
Right.
approach globally? Like, did you have to spend a lot of time educating people why they should focus on this? Or was it kind of overseas, maybe more of you?
I mean, first of all, like we're preaching to the choir with commissioner recruitment, right? Like we're going out to the people who are already so engaged and leading on these efforts in their respective regions. But I would say thinking about where the U.S. sits in this movement and in this dialogue, it's hard to generalize it. For instance, I think that parts of Asia are way ahead from a technology standpoint. It is becoming common practice in many offices across Asia, beginning with China and now in many other parts, that there's an expectation when you walk into the office, there is a live feed of indoor air quality. So it's green, it's yellow, it's red for the particular zone that you are sitting in. Like it during the pandemic became an expectation of the worker to say, you are obligated to prove to me that I am working in a place with air that is safe to breathe if you want me to be working out of this office. Another thing that's happened on the technology front out of Asia is an increased availability of technology that actually is in real time, measuring for different dimensions of air quality, and then in an automated fashion, driving HVAC and other systems. So if CO2 levels are too high, bump up the airflow. If particulates are too high, it might signal, for instance, that you need to change your air filter earlier than you were expecting to. And that kind of like real-time dialogue and automation at the building scale is a really, really important leap forward. But I do think that the U.S. rivals many other places across the world in terms of this elevated and growing level of awareness about the connection between air quality and disease transmission, the connection between air quality and productivity, performance, and cognitive function.
Amazing. So I always think kind of middle of the conversation is good to bring it back to kind of the basics and root of the conversation here. And just like 90% of our time is actually spent indoors. Millions of people a year actually pass away from kind of diseases or illnesses that come from kind of poor air quality, right? Like share a little bit more about like why this continues absent of pandemics to still be something we should all prioritize.
Yeah, I mean, or why it's so challenging for us to prioritize that in the first place, because we know that indoor air affects so many aspects of our physical, mental, and emotional health. We know, to your point, that poor indoor air can cause a whole host of health issues and even premature death because the air we breathe is invisible. It is literally unseen. It's easy to ignore a problem that you can't see. What is more is that it's really common for people to be unaware that poor indoor air quality is the root cause of the sickness that they or their loved ones suffer from. So whether it's asthma due to high levels of particulates from cooking or poor ventilation, respiratory and allergic reactions, and neurological issues from mold, higher than necessary rates of transmission of colds, flus, and other respiratory diseases due to insufficient circulation and filtration. Like it's so common for people to be mystified by their symptoms and feeling powerless to do anything to heal themselves or prevent sickness in the first place. So I just was talking to a reporter who, through her own work, has become much more aware of the impact of air quality. And she said, we just moved in to this new apartment because we needed a new room for baby number 2. And there's all of this pollution that's coming in from the outdoors because we're right next to like the big systems that power the entire building. And she said, I will go in after just a day or two after cleaning my baby's room and I can run my finger across the windowsill and it's like covered. And I was like, we need to have a talk. She said, I'm having a hard time convincing my husband that this is really impacting the health of our newborn child. And I was like, let me give you some talking points and let me make some recommendations for, fixes that can be implemented in a building that you don't necessarily own and operate. And that's just like one small example.
Right.
And in fact, she has a higher level of awareness because of her work than most people. And so I think part of the effort of this coalition is to make the invisible visible. It's to spread the word that there are nearly 7 million premature deaths every year because of indoor air pollution and ambient air pollution. This exacerbates a wide range of health conditions. It can lead to cognitive decline, impaired learning outcomes, things that can debilitate people, but especially children, for their entire lives. This is data coming from the World Health Organization. But then on the flip side, also to make visible the incredible benefits that we all can enjoy with healthier indoor air. We know, for instance, that improving indoor air quality through air cleaning and enhanced ventilation can reduce the likelihood of disease transmission and improve cognition by 61%. We know that in primary and secondary schools, reducing CO2 concentration can improve student learning performance significantly. So we want to spread the word. Like, the data is there. The research has arrived. It's the awareness component of it that we need to work toward, and really translating all of that knowledge into actions, into meaningful results, whether that is, public policy, whether that is technology innovation, whether that's financing these improvements. We've got to start to make those connections and knit these these conclusions together.
Yeah. So what I've always appreciated about you and IWBI is the action orientation of your approach, right? It's not only kind of raising awareness and getting us all educated, but it's about like, what can you do in your office buildings, in your homes, in your community to kind of address this? Talk a little bit about the benefits that hopefully all of these members of the coalition will kind of glean from the work you've been doing for your career and from IWBI, and what you want them to come away with in understanding how you can kind of help all of these communities globally do even more and kind of have an action approach to it.
I mean, I think in many ways, we're the convener here. Like, we're standing on the shoulders of the commissioners as the giants of research, of industry, within academia. What we're trying to do is really knit these things together, like I said, into a much more cohesive body, and to help a lot of those individuals elevate their own platforms, their own publications, their own work. I sometimes joke with my team that, white papers and third-party peer-reviewed journals are a great place for great information to go to die. And we want it to live, And so I think in many ways, we're hoping that with IWBI in this position as convener, that we can, be the rising tide that lifts the boats. And that we can learn from one another from geography to geography. Sure. So part of our ambition with the Global Commission is to publish a kind of singular document, which will be a global call to action, if you will. But then also additionally to work with various commissioners from across those 30-ish countries and growing to create national blueprints for action. So we'll start with that global framework for action, but then we'll localize those solutions through these national blueprints. And so this is an opportunity to make sure that it's practical and responsive to needs at a regional scale.
And talk about timing. Is this like a 1 year, 18-month rollout, kind of like phase one of the Global Commission, and then the rollout of like the blueprints, which I find so fascinating? Because if I'm not mistaken, they'll be kind of country specific, right? Like a deep dive amongst these 30 countries, and presumably, hopefully more will kind of, catch wind of the great work being done and want to participate, right?
Exactly. So this for sure is a multi-year initiative. This might even be a multi-generation initiative.
I mean, it has to be, right?
The scope of the problem, and given what we know is going to be the reality with the mounting impacts of climate change. One of the reasons why I think it's so important to be talking about this at Climate Week, the impacts of climate change are human. Paul Hawken likes to say the Earth is going to be fine. It's our ability to exist on this planet that is in jeopardy. And so we know that these problems are only going to become magnified. We're already experiencing that with every forest fire and bushfire, with increases in, moisture that leads to things like mold and mildew, with, hurricanes that, have a hugely compromising impact on indoor air quality when things get wet and don't dry properly and so forth. So, I think that we will begin with the release of this global framework for action. That's very much a collaborative document that will be working with a variety of our commissioners to author. That's slated to be released in 2026. But along the way, you're going to start seeing these national blueprints that get rolled out country by country. And one of the things I'm most excited about is that each of those blueprints will have its own flavor and maybe its own focus. So for instance, there's a group we've been talking to in the UK that wants to take up more of a focus on social housing. You've probably heard about some of the tragedies that have happened in the UK that are due to mold or fires, for instance. We have a group in Italy that's largely comprised of doctors that see improvements in indoor air quality as preventative medicine. And so their national blueprint will focus a bit more on really the direct connection between indoor air quality and disease prevention. So I think that's going to be really exciting that each of these can take on its own flavor and be led by, the leading experts and minds in those respective regions.
Yeah.
We've got 6 continents that are represented, and every country from Chile to Japan, from New Zealand to Ghana, and that's one of the things that makes this initiative so unique and such a different way of approaching what is often feeling like an intractable problem.
Yeah. And the magnitude of kind of rolling this out tomorrow, doing it in New York, doing it during Climate Week, it's a tough week in New York. There's a lot happening, but there's also no better opportunity where you have the right stakeholders involved, right? So like, as you kind of roll this out and you make this huge announcement, what are you looking for kind of a call to action, not only from like foreign leaders, but from the private sector and maybe some other folks who are going to be in town and kind of get to see this rollout happen?
Absolutely. Well, first of all, we're still recruiting for commissioners. So anyone who feels like they can contribute to this effort, feels like they'd like to take up a leadership stance within their particular country, we're hoping that they'll come out of the woodwork, raise their hands, and we can add them to the roster as we kick off this effort. I think.
I mean, is it government leaders or could it be companies in countries? I mean, is it an open? Okay,
we have CEOs, we have CMOs, we have CFOs that have joined on to the effort from the private sector. We've got scientists, we've got doctors, we've got policy experts. So it is intentionally diverse. I wouldn't say that there's anyone that we would look at and say, there's nothing that you can do to contribute because, air is everywhere. And then I think just in terms of a call to action, it really depends on, where you sit and who you're sitting next to. And so, for sure, there's a call to academia and researchers to help us to understand what the body of knowledge is and also where there are gaps that we might be able to fill. In some instances, the private sector and governments can step in to help to fund some of that effort or to bring forward the technical solutions to the issues that we've identified. But even just somebody who's like sitting at home or, listening to this on their ride into work, there are things that you can do to get started today. Everybody can take that step forward, get educated, test your indoor air quality. Today, air quality monitors are so affordable. I walked into the drugstore in New York City and they were selling them by the pharmacy. Consider getting one of those and monitoring your indoor air. Like, take control of your own health in that way. We have them all over the multi-generational home that I just built with my parents. And again, my mom suffers from permanent respiratory damage from being in sick classrooms. My niece has asthma. I have a 2-year-old and his respiratory system is particularly fragile as a young kid who breathes in more air in proportion to his body weight than we do as adults. And we have these air quality monitors all over the house. And it's been so fascinating to be able to really dial in. Like the other day, their VOC levels were way too high in our kitchen. And I'm looking around going like, what have I brought in that's new that would be off-gassing like this? Turns out it's the shoes that my wife just purchased. And I walk over and smell them and I'm like, oh, this is definitely it. You can smell the chemicals coming off of them.
I might try shoes and see how that goes.
Exactly. Yeah. It's just kind of like new gear in general, right?
Of course.
Or I think my parents have been really surprised at how much PM 2.5 levels increase when we're cooking and are thinking more about getting the fans, up and running, open windows and doors, et cetera. So, that knowledge really is power, whether you're thinking about it for, a commercial building, an office, or whether you're thinking about it for your home. A lot of people, when they ask, what's something I can do? It's like, well, when's the last time that you changed your filter for your HVAC system? And they're like, I have a filter. It's like, how have you been living in your house? Yeah. So, there are lots of little things. Another great example is choose healthy green cleaning products and, furniture and fittings for your spaces that are certified under schemes like Green Guard, Cradle to Cradle, Made Safe. So it's like everybody can do something, but we're really hoping that a lot of the leaders that coalesce around Climate Week will start to see air quality as something that is as fundamental to public health, but also to climate as clean drinking water. It's equally prevalent and probably has an even greater impact on many of our lives in terms of our day-to-day health and performance.
Yeah. And I think you sometimes talk about how the indoor air quality is just the entrance into kind of the healthier building ecosystem. And in addition to just drinking a lot of coffee, also work in commercial real estate. And my business partner, Wendy Feldman Block, and we spend a lot of time working with companies thinking about their real estate and office space.
Yes.
And it's something we continue to push. And we have clients who are still responding and wanting to ensure maximum, right? So I genuinely believe the momentum and catalyst that you and your team have ignited, continues. But it is something I think that you have to kind of remind people. You have to be persistent on, you have to be consistent on, because as we go to buildings, we continue to ask them about what are they doing? Because I think it's easy, and I'd love your feedback on kind of what are you seeing from the real estate kind of industry in general? Have folks gotten kind of a little lazier and maybe not as focused as they were in the past around indoor air quality? Are you still seeing an investment? Are you seeing a match of the technological kind of devices and tools that can help? Is that still on the right trajectory? Or is it kind of slow down a little bit?
I think, has it slowed down since it peaked at during COVID? Sure. But did it go back to the low levels of engagement that we saw before the pandemic? No. I think that real estate now fundamentally has embraced the notion that our buildings are part of the prescription for improving not just public health, but business performance by way of our people. And I think that, we're seeing, for instance, the rise of continuous monitoring of air quality as a best practice in real estate. And like I said, that knowledge is power. That's the beginning, is actually understanding what are the problems you're trying to solve in your particular space. We are also seeing in market research that a growing number of prospective employees, like people that are being recruited into different jobs, are asking questions about air quality and would make a choice. The company they choose to work for would actually be influenced by the level of air quality that they perceive inside of that workplace. So I think as we talk about return to office and how do we woo people back, or do we have a mandate that brings people back, this is part of the new expectation of that top tier talent that we're all trying to recruit.
Yeah. And clearly the success of this coalition is so tied and ingrained in kind of the reach and the impact on air quality, right? You've talked about so much of this, right? Like our individual health, our own performance, sustainability, and climate change, right? Like all of these efforts kind of around improving air quality, I guess it kind of makes a lot of sense why you've now decided to kind of champion a global commission. I think this is so exciting.
Yeah, like I said, we're not the heroes of this story, but we are a platform for elevating the stories of others, the good work of others, for bringing people together across different geographies to learn from one another. And so I'm so excited about all of the different ways in which we can exercise that convening power and really use that to build some significant momentum, keep up that drumbeat of awareness, and make sure that the conversation around indoor air quality is fundamentally embraced in the broader sustainability and climate dialogue.
Rachel, we're so enthusiastic, not only that you and your team are kind of pioneering it, at least bringing the community together to catalyze an actual global commission on healthy indoor air quality. And even more excited that you take time out right the day before this is happening to be on Coffee with Ken, to chat with us. I think it's just because, we have a long history together. You've been on before. We're always here for you. We're committed to what you're up to. And we just want to say congratulations. This is so exciting.
Thank you so much. We are so excited, and thank you for helping us to turn up the volume, and really looking forward to being welcomed back maybe for some future episode.
100%.
I aspire to be your most frequent guest.
I love it. And we're going to see you in DC in a couple of weeks, if I'm not mistaken anyway. So that conversation coming to the nation's capital, I think a very important time, and we'll be excited to see you in person again.
Absolutely. Healthy Building Policy Summit. It's going to be a riotous time, and I can't wait to be there.
It's going to be amazing. Well, Rachel, thank you again. Congratulations for all of you tuning in. Don't forget to like and subscribe and follow us on YouTube, and it's coffeewithken.com. Take care. Thanks, Rachel.
See ya.